Hey everyone, you might have seen some stuff about what's going on in China right now. Lots of like scary headlines and social media posts, all about a new virus, right? Packed hospitals and all that. So we're gonna take a deep dive today into what we can actually glean from people on the ground in China, and by that I mean like bloggers, medical professionals, anyone who can give us like a clear picture of what is really happening over there.
Yeah, I think it's really important to get that ground level view because, even though like officially the Chinese government is saying that things are under control,
Mm-hmm.
the personal stories that we're seeing, they're painting a much more kind of chaotic picture.
Yeah, I mean, it's kind of wild, right? It's almost like we're looking through a window into a parallel universe or something. But like one thing that I've noticed that keeps popping up over and over again in these accounts is just how overwhelmed the hospitals are over there.
Yeah, overwhelmed might even be an understatement.
Hmm.
Yeah, some of the bloggers that I've seen are comparing the situation, especially in children's hospitals,
Yeah.
to like the Spring Festival travel rush.
Yeah.
Yeah, that's like their big holiday travel season, so you can imagine just the absolute mayhem. Others have said that it reminds them of like the early days of COVID-19 and, with like parents and kids literally camped out in hospital hallways, like they've got tents and chairs and everything,
Yeah.
just waiting to get some treatment.
Wow, that's intense. And speaking of waiting, some people are saying they're waiting like a full day just to get an IV drip.
Yeah, the number of patients is definitely like a huge cause for concern. But I think what makes it even more unsettling is all the different symptoms people are describing. Like, it's not just, like a simple cough or runny nose,
Hmm.
right? We're hearing about like fevers, chills, dizziness, runny nose, sore throat, body aches. Some people are even saying they're losing their sense of taste. It's just the whole 9 yards.
Yeah. Yeah, and what's even crazier is some people are saying they feel even sicker than they did with COVID. I read this one post from a blogger who was saying that they had buttock pain, and they had the same thing when they had COVID. It
Yeah.
really makes you wonder if there could be some sort of connection there.
Yeah, it's definitely a possibility. And I think that brings us to the real mystery at the heart of this,
Yeah.
which is what is actually causing all of this.
Mm.
Officially, the government's blaming the flu and RSV, but a lot of people, and even some medical professionals, they're not so sure.
Right, like it just doesn't add up for them. You get that sense from a lot of these posts that people are thinking, hold on, something's not right here. And then you have that doctor in Jiangsu, he's saying there's this new unidentified virus and that it's even deadlier than COVID. He said that like 6 out of 30 of his patients had already died.
Yeah, wow, those are some pretty scary numbers. And then you have all these reports of kids developing white lung, which is a really severe form of pneumonia, and it can be incredibly dangerous, especially for young children.
Yeah, I read this really sad story about a kid. It sounded like they just had like a mild case of pneumonia at first, but then all of a sudden they got really sick and they had to be hospitalized.
Yeah, and stuff like that just goes to show you how vulnerable kids are right now. It's clear that this outbreak could be really, really serious.
Yeah, it's pretty scary stuff. So we've got hospitals that are completely overrun, all sorts of nasty symptoms, and nobody really seems to know what's causing all of this. It makes you wonder what else could be going on, right?
Absolutely. There's a lot of speculation out there right now. Some people think this new virus could be connected to COVID, like maybe it's some sort of lingering after effect or a mutated strain or something. And then you've got H1N1 going around too, which is no walk in the park either.
Right, and it's so weird how, even though we're talking about different viruses here, a lot of people are describing the same symptoms that they had with COVID, even when they test negative for the flu. This one blogger was saying that this year's flu feels just as bad as COVID did 3 years ago.
Yeah, and when you think about it, it's really not surprising that people are kind of freaking out,
Hmm.
especially given, China's track record when it comes to being transparent about health crises.
Yeah, right. There's this one blogger who was being sarcastic, but they were saying that the government's leading the way because all the streets are empty, but the hospitals are packed. You can definitely feel the frustration and even anger in a lot of these accounts.
Yeah, it reminds me a lot of what happened back in December of 2022 when China got rid of their zero COVID policy. Back then the crematoriums were overflowing, but the government just stopped releasing any data about funerals and cremations, which of course made everyone think that they were trying to cover something up.
It's like we're watching history repeat itself, and it's pretty unsettling. But I guess the big question is, what do we do now? If we can't trust the official sources, how are we supposed to make sense of all this?
That's a really good question. And it's one that we definitely need to talk about. We need to dig deeper and go beyond just the headlines and figure out how to separate fact from fiction. But before we do that, I think it's really important to take a closer look at what these personal accounts are telling us about what it's actually like on the ground right now in China.
Yeah, okay, so let's break it down. What are some of the most striking details that are coming out of these accounts? What really stands out to you?
I think one of the most concerning things is just how fast this thing seems to be spreading.
Hmm.
Like if people are saying they feel fine one day, and then the next day they're completely knocked out.
Right. And it's not just how fast it's spreading, though, right? It's also like how bad the symptoms are. There are even like medical professionals saying that this feels worse than like the COVID surges that we saw before. They're saying it seems more contagious. People are having really high fevers that just won't go away, and they're having pain everywhere, even in their eyes.
Oh yeah, I read this one post from a healthcare worker, and their 14-year-old son was saying that his tears felt like they were burning hot. I mean, it just shows you how serious this thing is and how it's hitting people of all ages.
Yeah, that's heartbreaking. And it doesn't sound like they're having much luck figuring out how to treat it either. A lot of the
Mhm.
accounts are saying that even the doctors are struggling to find anything that works.
Yeah, there was one medical professional who was saying they only started feeling better after they got IV fluids.
Yeah.
So that makes you think that maybe it has something to do with dehydration or an electrolyte imbalance. But, without any clear guidelines on how to treat this, it's basically like they're just guessing at this point.
So we've got this illness that spreads like wildfire. It can make you really sick, and they don't even know how to treat it. I can't even imagine how frustrating and scary that must be for people.
Well, absolutely. And then when you think about the potential economic impact of all of this, it just makes things even worse. I mean, if people are too sick to go to work or businesses have to close down, it could have like a domino effect on the entire country.
Right, and it's not just China either. Like, think back to how quickly COVID spread around the world and how it messed up supply chains everywhere. This has the potential to do the same thing. It's a reminder of how connected we all are.
Exactly. And it really underscores how important it is for countries to be transparent about health threats.
Yeah, when governments try to downplay things or hide information, it just creates a lot of distrust
Hmm.
and makes it harder to deal with the problem. And that's exactly what we're seeing happening in China right now. People are scared, they don't know what's going on, and they're desperate for answers. Even medical professionals are feeling lost.
Yeah, there's this one doctor who was talking about how they're finding all sorts of viruses in children. Like it's not just one specific thing. They said that the pediatric wards are completely full
Hmm.
and that they're seeing a lot of adenovirus.
Adenovirus, I'm not sure I've heard of that one.
It's actually pretty common. It's a group of viruses that can cause all kinds of illnesses, like the common cold, or more serious respiratory infections like pneumonia.
So is it like a specific type of adenovirus that's going around, or are they just seeing more cases of it in general?
That part's not clear yet, but what is concerning is that a lot of these kids are presenting with mixed infections. So they've got like more than one virus at the same time, which makes it even harder to figure out what's wrong with them and how to treat them.
Man, it sounds super complicated. What are doctors telling parents to do?
Well, this doctor was saying that it's really important to get medical attention right away if your kid has a high fever.
Mm.
They were saying that even if it seems like a mild case of pneumonia, it can turn into something much more serious really quickly, like white lung.
Ugh, white lung. That sounds terrifying. What exactly is that, and why is it so dangerous?
Basically, it's like a really bad form of pneumonia, where the little air sacs in your lungs fill up with fluid and inflammatory cells, and that makes it really hard to breathe. It can be caused by all kinds of viruses and bacteria,
Yeah.
but in this case, it seems like it's linked to whatever this mystery illness is that's going around in China.
Okay, so just to recap, we have these hospitals that are overflowing with patients. There are all these viruses going around, and a lot of kids are developing severe pneumonia. This is not looking good.
It's definitely a really worrying situation.
Mm-hmm.
And it's so frustrating because we're still mostly in the dark about what we're dealing with. Honestly, I think the lack of information is the scariest part.
I totally get that. It's like we're trying to find our way through a maze, but we're blindfolded. How are people supposed to protect themselves and their families when they don't even know what they're up against?
It's a really valid concern. And it makes you wonder about China's commitment to being transparent about global health. Are they more worried about controlling the narrative and protecting their image? Are they trying to prevent panic or keep the economy from crashing? Or is there something else going on entirely? We just don't know right now.
Yeah, there's a lot to unpack here. So if we can't trust official sources, what are we supposed to do? Where do we go from here?
Well, that's where these first-hand accounts become even more important. They're giving us a glimpse into what's really happening, without the government or the media trying to spin things. By paying attention to these stories, we can start to piece together a more accurate picture of what's going on.
So we need to be careful about where we get our information from. Look for different perspectives and really listen to what the people who are actually going through this are saying.
That's exactly right. It's about going beyond the headlines and connecting with the human side of this crisis. Because at the end of the day, it's those stories that will help us understand the real impact of this outbreak and help us respond in a way that's more informed and compassionate.
I don't know, it's just so weird, right? It's like on the one hand, you've got the government saying everything's fine, nothing to see here. But then on the other hand, you've got all these people on the ground who are like, no, this is really bad. It's hard to know who to believe.
Yeah, it's like we're stuck in this weird information limbo. And when you've got a government that has a history of controlling information,
Mm.
it makes it even harder to figure out what's really going on. But it's not impossible. I think one of the most important things is to make sure you're not just getting your information from one place. Don't just rely on like the mainstream media or what the government's saying. Look for independent journalists, researchers, bloggers, anyone who can give you a perspective that's outside of the official narrative.
So it's kind of like casting a wide net and then seeing what you catch,
Yeah.
and then trying to figure out how all the pieces fit together.
Exactly. And as you're doing that,
Hmm.
it's really important to be skeptical. Like, question everything you read and hear, think about who's saying it, what evidence they have, and look to see if other people are saying the same thing. Basically, you want to be like an information detective.
I like that, an information detective. But okay, so let's say you're doing all that, right? You're looking for different perspectives, you're being skeptical, but there's still so much information out there. It can be totally overwhelming. How do you even know where to start?
Well, I think one helpful thing is to try to focus on primary sources as much as possible. So in this case, that would be like those firsthand accounts we were talking about, the bloggers, the medical
Yeah.
professionals, the regular people who are sharing their experiences. Those are the people who are going to give you the most unfiltered view of what's happening.
Right, because they're the ones who are actually living it.
Exactly. And as you're reading or listening to those accounts, really pay attention to the details. What are people actually seeing and hearing? How are they feeling? What are they worried about? What questions do they have? Those are the clues that can help you understand the real impact of what's going on.
So it's kind of like reading between the lines,
Yeah.
trying to find those little human insights that you might not get from just looking at the numbers.
Exactly. And I think it's also really important to remember that this is about real people. These aren't just statistics. These are people whose lives are being turned upside down by this.
It's easy to get caught up in all the data and the technical stuff, but we can't forget that there are real people who are struggling because of this.
Exactly. Empathy is so important in situations like this. It helps us connect with what other people are going through and understand their fears and concerns. And it helps us approach this whole thing with a sense of shared humanity.
And that's really important when you think about it, because this isn't just China's problem, this is a global issue. What happens over there affects all of us.
Absolutely. We're all connected. And this situation really highlights how important it is for us to work together. We need to break down these walls that separate us and realize that we're all in this together. That means being transparent about what's happening, sharing resources, and working together to find solutions.
So it's not about us versus them, it's about us.
Exactly. We need to remember that a threat to health anywhere is a threat to health everywhere.
Man, this has been a really insightful conversation. But it also feels like we've only just scratched the surface. There's still so much we don't know, and this whole thing is changing so fast. As we wrap up here, is there anything else you want to leave our listeners with?
I think the most important thing is to just keep asking questions. Don't be afraid to challenge what you hear, and keep looking for different perspectives. Stay curious, stay informed, and stay engaged. Because the answers are out there. But it's up to all of us to find them, put the pieces together, and then use what we learned to make things better.
Well said. This has definitely given us a lot to think about, and it's a good reminder that we all have a part to play in dealing with these big global challenges. Thanks for joining us, everyone, and remember, stay curious.